get started. I want to thank everybody for joining. We're already just about 580 people on the call right now. I appreciate everybody joining this virtual town hall, and I'll describe the format in a moment, but I want to just make some remarks before we get started. One of the main point is that we really are living in a unique period in history with this COVID-19 pandemic. And it's a time where we absolutely need to come together as a community of scientists and physician scientists and scientists in training. And it's a time when we really need to refocus all of our activities on our shared mission as an academic medical center and focus on the public health imperatives that are needed to flatten the curve of the spread of COVID-19 so that our healthcare system and the healthcare systems across the nation have the capacity to care for those who will need medical care. Some of the most important preventive measures, and they really are so important that they bear repeating, are the importance of washing your hands frequently or using alcohol-based sanitizers and washing them for at least 20 seconds, coughing into a tissue or into your sleeve, not handshaking. We're going to change the way we greet one another now. Avoid touching your face, your eyes, and your nose. That's a hard habit to break for many of us. Clean all common surfaces with disinfectants or dilute bleach solutions on a regular basis and repeated. Physical distancing, stay at least 6 feet away from one another. As we're doing now, work, learn remotely. If you're sick, if you have any respiratory tract symptoms or fever, stay home, contact your primary care physician. We'll hear more about this from one of our panelists. And practice self-care. There's a lot of anxiety out there now. There was a very nice email that came from the Smale Healthy Campus Initiative yesterday that had enumerated a lot of resources that are available on the campus, but I think it's important for each of us individually and as a community to really pay attention to those things that we need to do to take care of ourselves. Be that sleep, be that eating well, be that exercise. We're not in a shelter in place yet. You can walk outside and try to enjoy the things that give your life meaning. This is also, and I want to make one more point, which is that all of these measures that we're taking are intended right now to limit the spread of COVID-19. But ultimately, it's the science and the research that is going to tackle this disease and pandemics in the future. So your contributions are absolutely critical now and in all future pandemics. So this is also an unprecedented time of just enormous change. And that requires us to really work together. And also as members of the David Geffen School of Medicine, to really embody the cultural North Star, to at every moment and in every action, do what's right, make things better, and be kind. We need to really take a public health mind frame in which we consider how our actions and decisions affect the spread of COVID-19 in the community. I want to let you know that the leadership of the School of Medicine is working very closely with the UCLA Health System, with UC Health, with our sister UC medical campuses, with all of our affiliates, Harbor, all of you, the VA, Cedars-Sinai, with the UCLA campus, and with national academic medical centers and schools and research institutions across the nation to ensure that we work collaboratively and effectively to address this pandemic. So just as one example, then something I think is a real first, a first for me, in the last week, I've had two phone conversations with my fellow medical school dean at USC, Laura Mosqueda, to determine how we could really work across USC and UCLA to ensure that we're doing the right thing in this era of COVID-19. And I really hope that this type of collaborative effort is going to not just get us through this pandemic, but is going to define biomedical research in the future. I want to say a word about communications. We all recognize that it's incredibly important that we provide clear communications to everybody in our community. Towards that end, the DGSOM communications team has created a DGSOM COVID-19 information website with up-to-date information for the school and with links to websites of the health system and the campus embedded in that website. So you can access that website if you go to the DGSOM website. It's on the banner that will link you directly to the COVID-19 information web page. We're also working hard to streamline all emails from the dean's office to only essential emails. We're working closely with leadership, including department chairs and CAOs, to provide updates. So as such, individually, if you have questions or concerns, we'd like to ask that you route those questions or concerns to your PIs, your program directors, your division chiefs, your department chairs, your CAOs, and they can then either provide responses or they can then escalate questions up to the dean's office. Another point about communications, if you're planning to send a message to groups of individuals, I want you to be aware that there is a temporary discontinuation of non-essential all everyone UCLA health emails. And I'd like you to make sure that you cross-reference any information that you include in those group emails with the information that's available on the DGSOM coronavirus information website or the UCLA Health COVID-19 website. And those are very easy to find if you Google them, and I hope that you've all bookmarked them in your, on your laptops and your browsers. When you send out emails, I also want to ask that you be very mindful of tone. These are very stressful and anxiety-producing times, and we want to make sure that the communications that we send out don't contribute, that they're productive in construction and they don't contribute to that stress. Finally, if you do have COVID-19 related communications or questions or requests, you can email the DGSOM COVID-19 communications team at, and it is available on the website, but it's a very unoriginal email address, COVID-19 DGSOM comms, so comms for communication, COVID-19 DGSOM comms at mednet.ucla.edu. I want to make a note about finances. We're going to be talking about the ramp down of our research activities, and I'd like to ask that you keep track of the expenses that are incurred by this ramp down. And Chuck Hajek in our finance office will be working with the department CAOs and about tracking if these added expenses in the opportunity that there are any federal or state bailout funds that are available to deal with those lost expenses. So this town hall is really aimed at providing further communication. We're going to hear today first from the Vice Dean for Research, Steve Smale, about research laboratory guidelines, then from Senior Associate Dean Greg Payne about guidelines for research trainees. We're going to turn then to Dean Victoria Sork from the College of Life Sciences to hear about research activities and trainings in the college. And then from Risa Hoffman, Director of the DGSOM Global Health Program and an Infectious Disease faculty, who'll tell us more about COVID-19. I want to ask you to type any questions that you have into the chat section. And as my colleagues are talking, I'm going to be monitoring those questions so that we can then turn to a Q&A session. And that Q&A session will include the panelists I just spoke about, but also Dr. Jeff Goodwin, who's the director of the Department of Laboratory and Animal Medicine, and Dr. Emily Marcus, who's the Executive Strategy Officer for the School of Medicine. And I will, as the questions come up, I'm going to focus on questions that are of broad interest. And I will then monitor that discussion so that I pose specific questions to each of our panelists. I want to add a detail that Dr. Goodwin has to leave at 12:45. So if you have specific questions about DLAM, I want to encourage you to ask those in the early part of this town hall. We are going to record this, and we will make it available for future viewing. We are going to keep the questions that are asked so that we can use those as a basis for an FAQ document. So if I don't get to everybody's questions, that just means that we will get to them at a later time point. So again, before I turn this over to Dr. Smale, I want to thank all of you for joining this call. I want to let you know that we're really dedicated to your safety and your well-being, and that we really consider you to all be critical members of our workforce as we address COVID-19. I've been really uplifted by the many messages I've gotten from research faculty, staff, and trainees who've asked about how they can contribute to testing efforts, to all sorts of other activities. And we're working closely with UCLA Health to determine how we can leverage all your expertise and your talents. And we'll keep you informed of those opportunities. So again, and finally, just given the very rapid pace of change here, I want to thank you for joining, but also ask that you continue to pay attention and that you look at that website for any up-to-date information. And so with that, I'm going to turn it over to you, Steve.
Great. And one quick procedural thing before we get too far is I thought we were instructed that the attendees should be using the Q&A function rather than the chat function to be sending in their questions. Is that correct? Because they're starting to.
That's fine. I'll use the Q&A, so you can use. I'll actually monitor both of them while you're talking. Okay, multitasking.
I think the Q&A is preferred from my memory.
Okay.
So please, attendees, send in your questions through the Q&A link rather than the chat link. Okay. So thank you. The first thing I wanted to point out that's important is that this is a town hall that is largely intended for laboratory and bench researchers, basic scientists, those running active research laboratories, not for clinical researchers. That there is a goal of assembling a separate town hall for clinical researchers that will be run primarily by Steve Dubinetz and Arash Naeem, that we will try to attend as well. That is likely to happen on Friday, but has not yet been announced. So for clinical researchers, please watch for that announcement. Some of the information today may still be relevant to you because we're going to talk about graduate students and trainees and some general issues as well, but just have that in mind. Okay, so I wanted to just reiterate the importance that I think there's so many attendees because everyone has seen the directive that came from the Vice Chancellor for Research to very rapidly ramp down laboratory research. And there was a lot of information in there that has some uncertainties and ambiguities that we'll try to address here. But this, as Kelsey mentioned, this is still a very important initiative. It's our social responsibility to contribute to this nationwide or worldwide effort to try to control this this pandemic. And it's fortunate that although we recognize, Kelsey and I are both still running active laboratories, that this is going to create considerable hardships for laboratories. It will create major hardships for our own laboratories, that it's something that we really need to do. And it's fortunate, I think, that the directive was crafted in a manner that does allow for the maintenance of valuable experiments and samples, mouse strains, cell lines, and things like that. So it's not so extreme that that we're going to need to be terminating valuable strains, for example. One key goal of the directive is clearly to reduce the density of researchers on campus and in the laboratories, as well as the density of critical support staff and DLAM facilities, custodial services, et cetera. So when you're thinking about, well, my laboratory can function just fine, we're small, you need to think about the broader impact on the community that includes support staff that will be impacted as well, where we need to reduce their densities. A reasonable goal for the ramp down period is that we're thinking that it should be possible for labs to really get to a point where they have perhaps never more than one person in the lab per bay at most, that really the people that are, after the essential experiments and ongoing experiments over the last few days, over the next few days are completed, that the staff that are in the lab should really be there for the purpose of maintaining important cell lines that can't be frozen down for any reason because important experiments are underway, for changing CO2 tanks, liquid nitrogen tanks, things like that. But there really should not be any active experiments except for those that have been approved. And other things, it should be immediately possible without any difficulty to transition things like lab meetings, thesis committee meetings, communications with collaborators on and off campus to remote mechanisms, including Zoom, which works great. That will of course minimize direct interactions between individuals. And also there's a lot of people that that should be able to, there should be fairly feasible for them to work remotely on data analysis and bioinformatics and things like that, that even though it may be more comfortable to be working in the laboratory on a laboratory computer, if at all possible, it should be, it's advisable to be doing that work remotely on a home computer or on a laptop. And finally, of highest priority, we really wanted to discuss our plans for considering exception requests for essential experiments. So that essential experiments that was indicated in the directive from the Vice Chancellor, that he did leave a mechanism for getting an exception approved that would allow a limited number of individuals to continue performing experiments that are considered to be essential based on an evaluation by the leadership. We've discussed this with Roger Wakamoto, have gotten approval for the following process that we plan to implement in the School of Medicine, and that will also be implemented in the Division of Life Sciences through our discussions with Victoria Sork. And we'll send this out in an email as well. First, we're really asking that all experiments that are ongoing be completed or terminated by next Monday, which is the 23rd of March, unless an exception has been obtained. The VCR has asked that we maintain a high bar for granting exceptions, and we feel that it's really important for us to do that, and the VCR will be monitoring this entire process and making sure that that high bar is maintained. Faculty who feel that specific key experiments cannot be completed or terminated by Monday, we are asking them to send an exception request, just an email message with about a substantial paragraph to the department chair or division chief by tomorrow. So we have to do this quickly, so we have a very short timeline on getting this done. And so essentially in that exception request, you should explain the need for the exception. Why is your experiment that you need to continue really essential, and why? What are the reasons? Does it have to do with the cost of getting it to where it is? The fact that it's a mouse experiment that's been ongoing for 3 months, and you've got a couple more weeks to go to finish the experiments and things like that. It's also important to put the timing into that exception request. How long will it take for you to complete those experiments? Hopefully most of those will be completed fairly soon after Monday, but others could last for another a few weeks. We're then asking the chairs and the chiefs to evaluate the request, compile them, and submit those that have merit to me by Friday evening. We then will assemble a committee to evaluate the request over the weekend, and will communicate our decisions to the chair and chief, and perhaps sometimes to individual faculty and to the VCR by Monday. And if a request is not approved, we're expecting that the experiments will really be terminated right away and not continue. The examples of essential experiment exception requests that may be reasonable, I think I've already talked about, that we expect a high percentage of them will be ongoing mouse experiments where there's already been considerable expense. What would not be considered to be an appropriate request for an essential experiment exception is that, well, I only have this 1 or 2 remaining experiments to do before I write my manuscript or submit my manuscript. Those types of requests will will likely not be granted because probably a very high percentage of people that are in laboratories are feeling the same way. It's also possible to submit your exception request to the website that was set up by the DCR, and there's already a couple of people who have done that, but those will essentially be forwarded to us and we'll go through the same process. So it's best, and they also need department chair approval, so it can be best to just send them to your department chair and cut out that, that additional interaction. So I think that will, is really the main things I want to say. The one other point I wanted to mention is that the NIH had a webinar that was held last week to discuss their response and how they are going to handle grant applications, deadlines for grant submissions, requests to extend a grant funding period. And they made it really clear that they're going to have really maximal flexibility, that the words they use are they expecting that that greater than 99% of requests for an exception on for an extension of a grant deadline will likely be approved. Of just stating how this was the ability to submit the grant was impacted by the COVID-19 pandemic. And they encouraged individuals to speak with program officers about other deadlines for reports or for extension of funding periods. They're anticipating an ability to apply for supplements and encourage you to speak with program officers about that as well. So it's really fortunate that the NIH is taking this seriously and understanding the impacts on the community. So I think I will end there. I think Kelsey, you're muted, but how do we tell you?
Okay, so why don't we turn over now to Greg Payne. Greg?
All right. Thank you. I'd just like to sort of, again, make a general introductory remark and then go over some specific issues that have come up related to graduate and postdoctoral trainees. This obviously is a fluid situation. I am communicating with program directors, home area directors, and the School of Medicine and Life Science leadership to try and, as best we can, maintain our research training activities. So the basic guiding principles that we're using is first and foremost what Kelsey and Steve have referred to as our social responsibility to help address the pandemic and flatten the curve. And so limiting contact, fostering social distancing is a main goal. And then within that constraint, to keep our trainees actively engaged in the research process and accordingly working remotely, except for the rare cases that might occur that might be approved if they are carrying on essential experiments. So currently, to address the question of trainee payments, UC Path and Grad Division are fully operational and processing payments as usual. We expect that this will continue. And so currently there are no concerns about our ability to pay the trainees. For undergraduate students that may be working in your lab, they really should not be in the lab and should engage with the research activities in the lab remotely. I'll mention a number of ways this can happen when I discuss graduate students, postdocs more specifically. Which I'll do now. Some examples of ways that graduate students and postdocs can remain productive in this period is to to prepare fellowship or grant proposals, work on manuscripts, perform data analysis, catching up on the literature, which I expect we all could use time to do. For students preparing for thesis meetings and exams, I'll address that more a little bit later. Perhaps taking advantage of the time to learn new programming or computational methods. And I know our programs are discussing ways that we can offer more opportunities for our students to get computational skills. As Steve mentioned, lab meetings and journal clubs should all be in a virtual format now, but should be maintained to continue communication and engagement. For graduate student thesis committee meetings, the basic goal now is to do our best to maintain student progress towards degree. The Graduate Council has relaxed the official policies for remote participation, so thesis defenses, committee meetings, oral exams can all be done using a remote format. At this point, I think it's you can make decisions on a case-by-case basis, but the general recommendation is to try and keep these meetings on time in the normal time frame, rather than delaying in an uncertain future for a time when in-person meetings are possible. I could be pointed out that the research ramp down will give trainees extra time to prepare for the meetings, defenses, etc. For first-year students, the circumstances surrounding the third or spring quarter rotation have raised questions. So we offer the following guidelines. Rotation students, I think by definition, are not essential personnel, so they shouldn't be involved in any in-lab activities. But at this point, for those first-year students that are out there, you should contact your scheduled third quarter rotation advisor to develop a plan to work remotely. The types of activities you could engage in are much the same as if you were a more senior student. You could, for example, write a research proposal based on a research topic in the lab. That both will give you the opportunity to delve deeply into the background and think about the experiments in the lab, and also provide a basis perhaps for a future NIH or NSF application. You could report on current literature relevant to the lab, participate in journal clubs if the lab has them, analyze data from the lab, use preliminary data from the lab that's already in existence to prepare a report on the form of a manuscript, things like that. During the rotation, again, to really foster engagement, it would be best if students are in regular contact with the rotation faculty mentor and, if appropriate, a direct supervisor for any of the activities that you decide to do. Rotation students should be fully incorporated into lab meetings and journal clubs. And also, this offers a good opportunity to arrange Zoom meetings with each of the lab members to find out what they're doing and get a sense of the lab. I think we would all agree that for those of us that have wet labs and do bench experiments and not strictly computational approaches, that a virtual rotation is not an optimal way for the student to get a sense of the experiments, sort of the methodology and experimental approaches in the lab, nor give the faculty member a great opportunity to assess the student. So it's a little bit hard to know, given the uncertainty, how to go about this, but at least currently, if during the course of the spring quarter or into the summer, the circumstances change so that students can go into the lab, then we have funding through GPB for the GPB students to be supported to finish the rotation in lab. That obviously will reassess at later points. The last thing is that for the students, I would urge you as we move forward that if you have questions or issues, please contact your program or home area director. If your PI, well, I guess contact your PI first, then your program and home director, and also you can contact me at any point with questions. And I guess that's what I wanted to cover.
Okay, thanks so much. So we're going to move on. Victoria, if you have comments to make, and then Risa, and I want to make sure we have a few minutes. A lot of the questions have come in for Jeff, and I want to see if we can get a few of those out before you have to leave. So Victoria, please, anything about college?
I'll be very, very succinct. First of all, I just want to say that we are, as much as possible, going to go follow the same policies and procedures as the basic science requirements in the School of Medicine. That'll keep it simpler. So I will not repeat what Steve said in terms of how we're reviewing, nor Greg Payne is handling graduate education for both School of Medicine and Life Sciences. So he is a good source of information. I just want to mention a few things that didn't come up. First of all, to the faculty who've not yet talked with their lab, please develop continuity plans. Make sure each of them, your postdocs, personnel, graduate students know what you're doing, and you have a plan with them. So I'd encourage you to get started on that. The one thing that hasn't come up is remote field work. That should be a request for an exception, but I think there's some really good reasons that one might grant them, and certainly I would say go ahead and submit them through the process. But I do understand fieldwork's different. I can understand the argument, but you still need to submit an exception in order to pursue it. Teaching assistants should have been contacted by their faculty member that they've been assigned to for next quarter. We have TA training going on right now. The faculty is working. I want to remind all faculty that their workload should not go up. They're still under union. If you really need a TA to work more than the hours they're supposed to, please talk with us about getting overtime. We can't just expect them to pick up more workload. Or we might have a way of giving you some additional TAs from units that may not need as much time. So please communicate and pay attention, and again, make sure that the people who've been assigned you're in communication with. And finally, the collaboratory is one option. If for those of you that have been postponing doing workshops, they have switched to remote education. So any of you that have been wanting to take that class on how to do Python or do variant calling, I've just talked with Matteo Pellegrini, and they're ready to accept you. So this might be a good time to use that. I think that's it for now. We'll go to other questions.
Okay, well, actually, I want to move over to Risa Hoffman, who's on an ID specialist who can tell us a little bit about COVID-19 in the current situation. Risa?
Okay, can you hear me?
Thank you.
Okay, my connection isn't the greatest, so please let me know if things are not working here. But hi, everybody. I'm just going to give a really brief update and run through of some of the latest in areas where you guys might be having some questions or concerns. So the first topic would be COVID testing. So importantly, this is being scaled up rapidly. We have our own in-house test at UCLA. We're testing 60 a day and moving to 90 tomorrow. All over LA County, this is happening in different academic centers. Additionally, there's testing available through corporate labs such as Quest. For individuals who have questions for getting tested themselves or for family members, the best routing is through a primary care doctor. But all big emergency departments in the city have set up typically tents outside so that anyone who doesn't have access can come in through a safe routing, get screened, and get access to testing. As we test more people, I'm sure you're all watching our numbers tick up in LA County, and we are finding this in our communities. Lots and lots now do not have the typical risk factors. So the messaging about staying home if you're sick, please do, because a lot of the illnesses we think we've been seeing are likely and have been COVID infections. The good news is we're currently seeing a pretty low case fatality rate in LA County. We're seeing a lot of mild infections in the community, and hopefully that will continue to be the case. There are a lot of questions around whether you can transmit if you do not have symptoms. And as you all know, as researchers, we're limited by the research we have on this. We do believe that the vast majority of transmission is coming from people who are symptomatic, and there may be a small portion of transmission that comes from people in the 1 to 2 days before they develop symptoms, and that you have to be in quite close contact with those individuals to be at risk from that type of transmission. Again, there's some data circulating on other types of completely asymptomatic transmission, but I think the take-home message is the majority of transmission we're seeing is from people who are symptomatic and sick. In terms of as a research group, you know, we are doing as much as we can to launch research at UCLA. We have hopefully opening at the end of this week a clinical trial of the antiviral remdesivir. It's an NIAID trial, and we're really excited to be able to have that, as well as access to compassionate use remdesivir through Gilead. There's an effort to do some research in healthcare workers, looking at testing and non-FDA approved testing and serology to look at how many healthcare workers are actually being exposed. And lots of great ideas circulating about research that we can and need to do. What I think we'd like to do, I know many of you may have found free time, is potentially generate a list of people who are interested in participating in research efforts. And if that goes through Steve or Greg, that could come to me as the division representative, and we can try to reach out and, based on your skills and interests, see if we can engage you in our efforts. And finally, I just wanted to speak about, you know, what you can do. I think, you know, I'm very passionate about research myself, and it's so hard to have to put down my line of research to focus on something else as important as it is. And I think we all have a role to play here, whether that's continuing to support each other through creative social media and ways we can be connected, you know, through the social distance that we have to have, ways we can support our community at UCLA, ways we can support our friends and family who are healthcare providers. So I think just being there for each other and, you know, giving encouraging words and washing hands and staying home if you're sick are all really actually very important things that we can all do to help this effort. So I'll end there. And if people have questions at the end, I'll stay on.
Well, thank you so much, everybody. Those are incredibly valuable points. We have 2 minutes before Jeff Goodwin has to go. There are 737 people on this call, and there are 81 questions. And I just tried to pull out some of the general ones that concern the vivarium, Jeff, that you could begin to answer here. But again, I want everybody to know, one, we're recording this. It will be available online, and we're going to use all the questions to prepare a frequently asked question document. So there are questions about DLAM and whether or not, let's say that new experiments are stopped, but will ongoing maintenance of animals continue? Will the pharmacy be open in case animals that are present in the vivarium need to be treated? And for experiments in which there are very long-term experiments with rodents, for example, will care of those animals continue? And finally, is there an opportunity for any lab personnel to participate in any of the care of the animals? Therefore, for you.
Thanks, Kelsey. And I probably have about 10 more minutes, so in case you want me to elaborate. So we are, just to let everyone know, we're working with a mostly full staff at this point. We haven't really seen a lot of effects of like the school closures. We were a little worried about that, but we have most of our staff here. So we're able to care for the animals that we have at this time, with a pretty full staff. And so we don't see that changing until we see, COVID-19 exposures and people being sick, that sort of thing. So for right now, it's kind of work as usual. We have ramped down a few things like our training classes, for instance, our walkthroughs. However, things like the pharmacy, all the things that we do in breeding. I saw a question about transgenetics, the biopsy services, those sort of things. They'll all continue at this time. Of course, things change, but they will continue. We're basically planning. We have kind of prepared kind of a phased approach to how to deal with less and less staff if that's what happens. So we're kind of in that first phase where we're just doing a few little things to kind of save time for ourselves. We can go to most of what we work with are mice. So if we can do anything to save work for ourselves, such as going to longer cage change intervals. Right now we change like one or two, or we change like every week or every 2 weeks, depending on whether this is static or ventilated caging. So we can go to longer, intervals. So 3 weeks or 4 weeks if we only have 1 or 2 mice per cage. So hopefully everyone will bear with us. I know some people don't like that, but again, hopefully you understand that we're in a situation where we need to do that so that we can care for all the animals that we have. Did I answer all those first questions?
Yeah, I think so. And you're reading the other questions, so why don't you just pick out the ones that are really that you're able to address?
Okay, let me see here. Go down the list. So yes, I saw the question about can we help, and I think what we'll try to do is communicate. As we as I said, go through these kind of phased approaches to dealing with less staff. We'll try to reach out to the researchers. So if you see an email from me, please read it. There may be some important information in there for you. And if we get to the point where we really need to have some help, we will definitely reach out, and I'm sure we'll be more than happy to use help if it's there. I see a question here about locking down. Who decides on this? Right now, we don't have any plans to deny access to people. So if they need to come into the vivarium, obviously we're not going to stop them. We've actually sent around some guidance. I think there are some questions here about these little gold stars. We're trying to get people to identify what we're calling unique and irreplaceable animals. That would be animals that obviously unique strains of mice that you can't get from a commercial vendor. 2 or 3 breeding pairs of those. We'd like for people to put these little gold stars that we're making available, put those on the cages. There's humanized mice that have tumor implantations and they're in long-term experiments. Obviously it's a significant loss if you have to euthanize those animals, so those get gold stars too. I think you can understand anything that's really a great expense to lose, or animals that are just irreplaceable for whatever reason. Definitely put gold stars on those. We have those available as of today. In that guidance that we sent, we can resend it again, but it tells you where to pick those up. Most of the supervisors in the areas where your animals are will have those. And there's a central office, sorry, I don't have that room number, a central office on the first floor of CHS where you can pick those up as well. So we hope that over the next few days, while all of your staff are here, you would go and identify those animals for us, because it will be, if we get to phase 10, we hope that we don't get to the point where we have to make choices on which animals to care for and perhaps euthanize some. We hope that we don't get to that point. That's kind of a long ways off from here, but if we do, it'll be helpful to know what's really irreplaceable. Let's see here. Mouse deliveries being canceled. Right now, we're only, we are holding some of them. There's a few that have been approved. I think we talked about that earlier. There's an approval process for essential work. So those are going to the deans or the VCR's office. So definitely we can still get a few deliveries in. We are getting deliveries from the vendors. So if it's essential work, we are able to get that. Looking down the list here.
So one question that I see is about breeding colonies. Do you want, will you continue all the breeding colonies, and can they wean the pups from the cages?
Yeah, I think I saw that question. I wasn't sure if they were talking about in the DLAM area, in our area that we manage, that the PIs don't have access to. Yes, we'll continue all of the work in there with all of those lines that are there. We are really hoping that they will not submit any more requests to pair those animals up for breeding, because we really do need to kind of hold that work so that the staff there can just pay attention to the animals that we have and care for the animals that we have. So we're hoping that they will not pair any more animals for breeding, and that once we, wean what we have, that will be it as far as breeding. We understand that there may be some critical lines or hard to breed lines that we do need to keep going, and that's fine, but we hope that will be kind of a minimum so that we can use our resources for important work.
And another question that I'm going to try to frame in a more general way, but it had to do with somebody who had an ARC inspection scheduled this week, and they were told it was going to continue. And so if you could just say something generally about the sort of inspections from ARC and DLAM and what the state.
So I understand that some of those inspections, what I heard was that they'll be reaching out to the labs just to kind of ask if it's okay to do those. I think the ARC understands that this is kind of a difficult time where people are really busy ramping down. So I think you can have those postponed if you just have to kind of let them know that it's too much of a hardship to have those inspections at this time.
All right. Is there anything else that you see that you need to immediately address, Jeff? Because there are some other ones I want to direct to Steve at this point.
Okay, yeah, no, I think that's it. If everyone could, like we say, if they haven't received the guidance on those little gold stars and kind of identifying unique animals, that's kind of what's critical for us, for them to do that. So maybe we'll send, if we can, we'll send another email out, and if they could, when they see that email, if they could just read through that carefully, that would be really helpful for us for down the line.
And I would like to send to you the copy of all these questions, pulling out the ones that are relevant to animals. And if there's somebody in your group that can provide some answers, we'll put them on the FAQ.
Okay, happy to do that.
Okay, thanks a lot, Jeff. So much appreciate your help here.
Okay, thanks.
Steve, there are a lot of questions about how do people actually make the requests for exceptions, and who is in it, and I know that we're about to send out an email from your office, right, but maybe you could say a word about that.
Yeah, so that I've actually just been answering a few dozen of the questions, so I think I've hit that several times. But yeah, the exception requests go to the chair of the department, the division chief. That they should be just an email, good paragraph or so, justifying the need for the essential experiment exception, and a little bit of information about the timeline. When will the experiment be completed? Who needs to be involved? How much effort is needed for that to happen? The department chair, division chief will then evaluate it to see if they think it's appropriate, and if so, we'll forward. And then this needs to be sent to them by tomorrow, by the end of the day tomorrow, and then they will send us the ones on Friday that they consider to be appropriate, and we will evaluate them over the weekend and communicate with with the VCR. And the same holds for life sciences, where Victoria also would like faculty to send their request to the department chair, and then the department chair will communicate with her and her team. I got one question that I saw of someone saying that, well, I have pages and pages of essential experiments that I'm going to need to submit, and I think that that type of is suggesting that it may not be thinking about the essential experiments quite correctly. That we're expecting that these are very, very few experiments. Most of them would probably involve animal experiments, where it's an ongoing, expensive experiment that that to terminate the mice now in the middle of an experiment with only a couple weeks to go would be financially devastating from a time perspective. But certainly, I've got an important experiment. I need it for a grant deadline. I need it for a paper. I need it for to complete a thesis. I need it before a postdoc starts looking for a job. I need it. Those types of things will generally not be approved, unfortunately. We wish, in many ways that this had more flexibility, but this is the reality of what what we've been asked to do.
All right. A couple other, I just want to point out that Colin Dimmick wrote that EH&S is available to help labs that need any assistance through the ramp down process, and that you should contact Brian Ruiz, R-U-I-Z, at the Director of Research Safety at EH&S. And that Jennifer Perkins wrote that they're working closely with USDA and OLAW on ARC inspections, and they'll be reaching out. They're going to try to be flexible. They don't want to get way off schedule, but they will be working with PIs. Another common question that's come up that, Steve, I'd like your take on, and any others, has to do with the core facilities. So a lot of the core facilities provide what is essential research. And so what's happening at the core facility? Yeah, so the core facilities have been, are making their own decisions because there's so much variability in, how they're operating and what they can do in a reduced capacity. Some are really feeling that they just need to shut down because they can't keep going in the dramatically reduced capacity that is expected. So this is something that needs to be worked out. Is for essential experiments, that is, we have to see how much of a burden that will be. Again, we're expecting it to be a pretty limited number of essential experiments for a limited time period. So, I would encourage faculty who get approval for essential experiments to speak with the core facility director to find out their plans to see, do they have the potential to operate at a reduced capacity? But I don't think that we can make a mandate, a global mandate about that issue because of the great variability in core facilities. Okay. This is a question for you and Greg and Victoria, and I think everybody, which is, there are a number of comments ranging from, is there a maximum number of essential personnel allowed in a lab, to my PI doesn't want me to leave the lab and I'm uncomfortable, to, how do we define who should be in the lab? So can you please comment? I mean, I started out this town hall with the real importance, and it was reiterated by Dr. Hoffman, of physical distancing. And can you give some guidelines along those lines? Well, Victoria, you're going to jump in? Or
yeah, let me I'll say a few things that I think are general. PIs cannot require graduate students, postdoc students to act as essential personnel. And in fact, if anyone feels that unsafe, they feel they shouldn't leave, they have caregiving, they're over the age of 65, any of these individuals that may have been essential, if they don't feel comfortable, it's their option. It's not a PI's option to do it. So that will create enormous problems on that end. I think this whole issue of who's essential and what is essential is really rather tricky. Some it's a little more obvious, like DLAM, we really need DLAM to continue to function. Some people have living material. I would say err in the direction of put in a request to the chair and just clarify what you want, because it would be hard for us to go through everything is its own case. So please put in a request for an exception. And the other part is personal safety means try not to have any more than one person in the lab at a time, which Steve said, and I want to highlight that. So that should also help reduce the, help promote physical distancing and also just movement of people who could be dispersing germs. So I think that's the other point for social responsibility of removing dispersal.
And the issue of essential personnel, that this is supposed to be essential personnel that are coming in to maintain a mouse strain, not to ramp up or perform experiments. Also to personnel needed to change CO2 cylinders, liquid nitrogen tanks, maintain cell lines, but not to perform new experiments. So so the, it generally, I think it doesn't really matter to us how many people are on that list if you want to distribute the responsibilities, but, but it's not, again, for the purpose of saying this person's an essential personnel and they're going to come into the lab and do a ton of experiments. It's really for the maintenance, idea.
And I just want to add that we're in a phase right now of a ramp down. We have not said that people cannot come into the lab. There are a lot of questions about, I do most of my experiments remotely anyway. I work in machine learning, but I have to come in every once in a while. Is that okay? It is okay, but you have to just be practicing having very few individuals in the lab. But it doesn't, we are in a ramp down period at this moment in time. There are also,
Kelsey, this is Greg, could I add something? So for students who feel uncomfortable about exercising their right not to come in, they should feel free to contact their program or home area directors or me for support. And
important. Okay, that's important. I also want to point out there are a lot of questions about, will there be time off the tenure clock for junior faculty? How will hourly employees be paid? Foreign students who are here on a visa. We will be getting a lot more information to you from human resources and from academic affairs that address these questions. But the way to think about it right now is that, again, in this time where there's so many changes going on, there is an enormous amount of flexibility, and all of these issues are being discussed. The issue of time off a tenure clock is being discussed in the Office of the Vice Chancellor for Academic Personnel. HR, there have been a lot of notices that have gone out about people being able to take, have time, leave away from the lab. I do not think at this moment in time it's the appropriate time to be worrying about who's going to get paid, who's not going to get paid. We have to ramp down our activities and then address those issues, and they're being addressed at HR in academic affairs. Maybe Steve or Emily, you can say something about what the NIH said about people who are being paid on NIH grants who may or may not be able to continue, the work in the lab in this immediate period.
Well, the NIH is expecting to be very flexible. They haven't specifically said things like, if somebody's, on a grant and has to be paid for, just depending on how long, certainly for, 8 weeks, there's going to be no difficulty with the NIH understanding issues. If this extends to a year, it's really hard to know how the NIH's policies will evolve. But at this time, they're expecting to be, incredibly flexible.
What they said specifically on the issue of continuing to be paid off a grant, even if there's a temporary interruption in being able to do the work on that grant, is that they will follow whatever the institutional policy is. So if the institutional policy is to continue to pay people, even if the work is temporarily interrupted, which at the moment is DGSOM's policy, NIH is going to honor that. They're not going to come in with a different policy of their own that sweeps across institutions. I think, the main message from NIH was focused really on doing what's right and staying safe and living up to our social obligations now, realizing this will have impacts, and we're going to sort those out, and those are sort of the next order of questions, but that in that sorting those out, because of course that's can be very vague and anxiety producing. If you think, trust me, we'll sort it out, that everyone's expectation is for flexibility, for support. Everyone, these are not individual choices people are making. This is a global pandemic. And that in sorting out all of the impacts, which are numerous, and particularly the research community as well, both here at DGSOM, at NIH, at all the funders, everyone is preaching flexibility in addressing all the consequences of the steps we have to take now, and assuring people that we will all be looked after and looked after each other, but that right now the most important thing is to focus on stopping the spread.
Yeah, a couple other issues that have come up. this is an easy one to address about access to the labs being controlled somehow. The research buildings are going, if they have not already, going to be on, off-hour weekend access with card key only now. And the reason for that really is that we do want to make sure that we decrease the number of people in the labs, and we've had concerns from individuals about safety in the lab when there's only one person or two people in the lab on a floor. And also to protect all the equipment and supplies, etc. So people have to remember to bring their Bruin ID cards to get into the research buildings now. Another important question that came up that Greg, I'd like you to address has to do with, we've been talking about graduate students, for example, who can go to their program directors, but there's a concern about postdocs where the PI, in both directions, where a postdoc wants to stay in the lab, can a PI prohibit a postdoc from coming to the lab? And conversely, if you're a postdoc, who do you go to for support if you're concerned about the situation you're in terms of your research lab and the ramp down?
Sure. Victoria, do you want to address this too?
So I'll just, also say, I think if the person, postdocs can either go to the department chair. If they don't feel comfortable with department chair, postdocs could go to Greg, who also works with postdocs, or even send a note to Life Sciences, can send a note to me. We do not, the deans do not want anybody feeling that they're under pressure, and we will handle it discreetly. But we do have to do is comply with university policy and ethics. So, but I think, Greg, you're always approachable, and if anyone feels like they need someone to talk to about how to handle it, I think Greg is a good person, but I'm, if you know me, please feel free to email me as well.
Or Lynn Talton, obviously, in the postdoc office.
Right,
it's a
right,
great resource. And all of, we're working very closely so that there's funneling up of all of these sorts of questions. Another issue that came up is people who either take public transportation to the campus or, are going to have to come at different hours because there's shifts in the laboratory. Is there going to be available parking? And I just want to let people know that that is something that the Vice Chancellor for Administration, Michael Beck, is working on. So stay tuned on that one.
Can I add something, Kelsey?
Yeah, sure.
Because I asked him, I raised it, and in the initial time I raised it, they are not thinking about providing free parking. So that's not an option, but people can go online and get parking permits for $6. And that's feasible. Right now, there may be a limit on how many days, and I think the next approach is see if we can extend that limit. But
And I just want to point out, for those of you who are in research labs who are also healthcare providers, the parking is a slightly different scenario for when you're involved in patient care. And we can address that later. Another really big question that's wonderful is how can people participate and help with testing? People want to donate their PCR machines. They want to do anything they can to help. So, there are some constraints. I'll maybe pass it over to Steve, who's aware of these. We've been in contact with the head of our clinical microbiology lab to see what can our research community do. Many of you have read at University of Washington that there were research faculty who were engaged in helping with RT-PCR and so forth. In fact, what they were doing is really helping with the sort of administrative aspects of logging in all the samples. The work itself has to be done in a clinically approved setting at this point in time, but there are other opportunities. And so maybe Steve and Risa, you can say something about that.
Well, just to reiterate that Kelsey and I have both, I think, multiple times been in touch with the pathology lab that's setting up the in-house testing and doing the testing, and have, told them, asked about specific scenarios, and they really don't think that they have a need for additional help at this time. But we've emphasized to them over and over again to let us know if anything, arises that could benefit from the research community. Just let us know, and they've agreed to do that. So we will let people know if something comes up. But I think their barriers are at a different level.
And just, this is Risa, even small things, you know, I know recently a bunch of people were asked if they had any extra goggles because we're short on PPE at the hospital. So, you know, if there are unused types of PPE in labs or, you know, that type of thing is incredibly helpful. And I also mentioned we're trying to organize within the Division of Infectious Diseases some different teams involved in research. So we can, you know, message back to you guys with what our needs are, or if people are interested, we can find a way for you to submit your names and your areas of interest through, I'm not sure who would be best, Steve, if that's you or Greg, and I can get that list and we can keep it on hand for anything we come up with.
I don't think we need any more goggles. The response, it's just really amazing to see the community coming together. The response to the goggles request was unbelievable. And I hope that issue is resolved for now. In fact, we became pretty nervous about it because it ended up in, you know, worldwide international social media that we were struggling with goggles at the UCLA campus, and had people contacting us wanting to buy things and send them to us. And it really got a little out of control. But
yes, so that's how we do. We just have to learn how to deal with all of these things. But it is a great thing that people have been
the
so
community
generous.
response was amazing, and I think, you know.
All right, I'm trying to look at some of the other. Any of you who are on the panel, if you see questions that you think are important.
One question that I think might have been also, I think there was one question about, you know, that you're concerned about is a PI pressuring postdocs to be in the lab, but I think it was actually potentially worded in the opposite, is that can a PI prevent a postdoc who really wants to be in the lab from being in the lab? And the answer there is absolutely yes, that, you know, that PIs have been instructed to you know, ramp down and research operations if at all possible, and that involves the PI telling their staff not to be in the lab. And so that's expected to be respected and followed by postdocs, graduate students, and staff.
So really,
where to donate extra PPE? I don't know, Risa, did you already answer that? Is there a place for well, labs can donate their extra PPE?
there was a
I would wait for a request of, you know,
we'll organize one. We'll get it out to everybody, and we're going to have emails that go out, and we'll include that if at the time that we need them. But I do want to ask people, and it was that you make sure that you keep your PPE in a protected place so that it is available when you need to, if the health system needs it.
And I think after, you know, we haven't been able to answer all the questions, but I think after this is over, are we still going to be able to go through the questions that haven't been answered and answer them, and they will be accessible to people just by logging onto the same webinar, I guess.
Yeah.
And I can say just from reading them, the ones that are the most difficult are the HR related questions, just because, you know, although there's been clearly an interest in being very flexible, and we can even see this over the last week that policies have become more and more flexible over time concerning HR, but those are the decisions that just really haven't been made yet, and so we can't really give answers, specific answers to many of the HR related questions.
And a lot of them depend on whether they're employees who are union represented or not. And so but there's a lot of work looking at that, but there are a lot we can't give answers to. And again, the HR team is working closely with the CAOs to provide information on those activities. There was one important question somewhere. I'm trying to scroll down. We're now to 140 questions, up to 140 questions. About staff who could work remotely, but they don't have the access to technology to do that. And I think that we have been working to try to make available for those individuals who have no computer at home, for example, that to be able to work with their departments to then funnel information up to us to see what can be made available for any kind of essential work that could be done remotely. And I hope you all saw that Charter and Spectrum is providing free internet for the next 60 days for people who don't have access. All right, any other 142 questions? Let's see.
Oh, I just saw, there's one that a comment just came in from Joanna in DLAM saying that DLAM could still use donated PPE, especially N95 masks or surgical masks if labs have extra. We ask that labs please do not take any extra from our PPE stations. We are very low in our stock. Contact Matthew Dang if you have extra masks in your lab that you do not need. So Matthew Dang is mdang, D-A-N-G at mednet.ucla.edu.
Great. All right, I think anything else from any of the other panelists?
I will. Go ahead.
Sorry, no, go ahead. Go ahead.
I could see that there's a lot of questions on free parking. I think
Yeah, I
the
see
name was
that.
free lunch. But anyway, I've just written to Michael Beck, Kelsey, to see if they're going to revisit this this issue. Someone said, could it be provided for essential? Then it's got to be somehow or another. How do you officially get designated as an essential employee so you qualify? But we'll see what Michael Beck has to say.
Yeah.
I personally am not opposed to it.
Yeah. Yep. Anything else from anybody? Emily, were you going to say something?
Well, I mean, it was just this question about emergency seed funding for COVID research. And I just know it's not something really relevant for this call, but there are funds being developed and built. And I think you already talked about it a little bit, but if there's anything else you want to say about people who the plans, what DGSOM is doing and to support COVID research.
So I can take that. So we're just appointing a COVID-19 research task force that will, that will take the lead in kind of coordinating activities. There's a lot of research activities taking place, especially on the more clinical side. And there's, been discussions and phone calls with, 20 to 40 people. And so there will be a task force that will take care of that in terms of funding. But, I think seed funding for certain activities, certainly may be made available, but hasn't been, needs further discussion. But I think a lot of this will go through this task force that we will communicate very soon as it's fully assembled.
And we've put together a donor fund that should support education and research on COVID-19. There are a number of people who are interested, so we would have a resource for this.
And there's also a question about the sort of rough period that we're planning for in terms of the ramp down and what I've been hearing, but again, Steve, Kelsey, Victoria, correct me if I'm wrong, is that basically we're thinking about 6 to 8 weeks as a time period. I mean, obviously everything is changing so rapidly, and that could change to be shorter, in 48 hours, or it could change to be longer. But as of today, with the information that we have, 6 to 8 weeks is the rough period that we're looking to plan for. Is that correct?
Well, I mean, you've seen that the campus has moved to all remote learning through the spring quarter. I think for this period, we just don't really have great enough data to know how long it's going to last. I think, whether it's 6 to 8 weeks, I think I can tell you in the medical school, some of the changes we've made in medical school education have been for 3-week periods so we can reassess. I think, unfortunately, it's when I said that this is a period of uncertainty, that's one of the areas where I just think we don't have that level of certainty. And maybe, this is an area where I would also defer to Dr. Hoffman with her ID expertise, if you can just say a word or two about what your expectations are. And I'm not talking so much about the expectations for the actual epidemic, but for the immediate impact on our research activities.
I'm going to add something about undergrads to highlight, which is many of our faculty do supervise undergrads, 99, 199. Those undergrads cannot come into the lab. Some of them have you know, they're either work study students or they are getting financial compensation. They need this money. They also need the experience. So the extent to which either you or someone in your lab can find a remote project for them to do so that they could continue to get that undergraduate research experience. So again, now there are undergraduates that are on campus. They're still going to be in the dorms next quarter. So they're very much prepared. I need to get a clarification. If they're on campus, what does that mean? They cannot continue an experiment, but they certainly can work remotely. But please, I'd like you to try to support those students in whatever way you can so they can get the educational experience they were hoping for. And some of them have research internships money, and we don't want them to feel like they have to give that money back. If you have any questions or comments about undergrads that you're supervising, go ahead and let me know.
I will just say in Roger Okamoto's directive, he says with the expectation that suspended lab access will likely last at least 6 to 8 weeks.
Yeah. Yep. All right, so why don't we start to close down here. If there are any final comments from anybody else on the panel? I want to thank everybody for coming. We're doing our very best to make sure that there's clear communication, that there's coordination between all parts of the campus and the health system. Please look for the emails. Again, we've reduced non-essential emails, and also look at the website and stay away from each other physically, but stay in touch with each other to keep your sense of community. Use this time productively to think, to read, to work on projects, to write, and again, really focus on your wellness because, you know, if this is 6 to 8 weeks, if this is longer, we all need to adjust to a very different environment, and we need to do so with a strong contract with our social public health. So thank all of you for joining us. If we need to have another town hall, we'll schedule another one in the coming days or weeks. So thank you again, and thanks everybody on the panel for joining us.